Great. So thank you all again for joining us today. This is a big day for us. Coming out of conference and being able to talk about making a difference in our teams and things that we've been working on for a number of years to get going. Couldn't be more excited that today we sit here to be able to talk about the opportunity for offering benefits moving forward. And so today's webinar is going to be hosted by Bernard Rubenstein from Franchise Benefit Solutions. Bernard and I met a couple years ago and really started looking at how the plans that his team offers, how it could fit into our organization, and really through this year, work to see what types of things are out there for franchisees of all sizes, right? From small to large, can handle someone, if you have one person who's wanting benefits to if you're trying to get for an entire team. So I'm excited because this is probably one of the first webinars that we've had also representatives from all three brands together on one webinar to sort of learn and move forward and leverage the power of everything that we're trying to do. So with that, I'm going to shut up and turn it over to Bernard as we go through today to learn about the types of plans that are offered, what timelines look like, and how to move forward if this is something that you feel like could fit into your business or organization. So, Bernard, thank you for your time today, and so excited for this new partnership that we have.
Thank you, Chris, and good afternoon, Mainline Brands franchisees. I'm Bernard Rubenstein, Managing Director of Franchise Benefit Solutions. I'll be guiding us through the next 30 minutes or so, during which we'll cover several key topics, including facts about franchise benefit solutions, challenges facing franchisees, our program advantages, our products portfolio, benefits enrollment platform, solutions to help you hire and retain employees, looking ahead to the group special enrollment period, and we'll end up with questions or comments. If you have any questions along the way, please feel free to use the chat box at the bottom of your screen, and I'll address them at the end. With over 40 years of experience specializing in customized benefit programs for the franchise community, Franchise Benefit Solutions offers exclusive plan designs tailored to franchisees across the United States. We have a deep understanding of the unique challenges and needs of the franchise industry, allowing us to focus on building effective benefit strategies and fostering long-term relationships with our clients. Over the years, we've had the privilege of partnering with industry leaders such as Authority Brands, Best Life Brands, Five Star Franchising, Velpac, Grocery Outlet, The Joint Chiropractic, and Jenny Craig, amongst others. Providing quality, affordable employee benefits is one of the most important challenges facing the franchise community today. By offering a strong benefits program, you can compete more effectively for top talent and retain skilled, experienced employees. Unfortunately, many franchisees may not yet offer this essential advantage. Here are a few we often hear about. Number one, the lack of benefits to attract new employees. In today's competitive job market, offering strong benefits is crucial for attracting and retaining top talent. Number two, affordability of healthcare. With rising healthcare costs, many franchisees struggle to afford comprehensive coverage, which can directly affect both recruitment and retention. Number three, limited back office knowledge. Many franchisees come from non-business or corporate backgrounds and may lack experience in managing benefits, adding to the complexity of administration. And finally, number four, healthcare mandates. Franchisees with over 50 full-time employees are required by the Affordable Care Act to provide healthcare coverage or face penalties, adding another layer of pressure. At Franchise Benefit Solutions, we understand that every franchise operates a little differently, which is why we've developed flexible solutions to meet your unique needs. Our program offers a number of key advantages designed to simplify your benefits management and provide your employees with quality options. Our program includes exclusive group plans and rates for mainline brand franchisees, uniform plans and rates nationwide. Whether your franchise is located in Florida, Michigan, or California, you'll have access to the same plans and rates across the board. Flexible participation. We don't require employer participation or contributions. Our plans can be employer paid, standalone, voluntary, or packaged together through payroll deductions, giving you full control. Customized benefits. You choose the benefits you want to offer your employees, ensuring your package fits both you and your business and your team. And finally, streamlined enrollment. Employees can enroll easily through our online portal, making the process efficient and hassle-free. Our portfolio of products include medical, dental, vision, life insurance, accident, critical illness, hospital indemnity, telemedicine, prescription drugs, short-term disability, and for 2005, we've added pet insurance, legal, and identity theft. Again, plans can be employer paid, standalone, voluntary, or conveniently packaged together through payroll deduction. Our platform includes 3 health plan options: individual and families, comprehensive group health plans, and voluntary group health plans. For those franchisees that don't want to offer a group plan for their employees, but are looking for an individual health plan for themselves or their family, we offer an online quoting portal they can view at their own convenience. If a franchisee is considering their group plan options, we can help them make the right decision that best meets their healthcare needs of their business and their employees. Group plans are based on the demographics of their company, along with their employee and dependents' ages. We would need census information in order to provide them with a group plan proposal. As you can see on the screen, there are 2 types of group plans that we offer. Major medical, which we require a minimum of 2 employees. Plans are community rated. Rates are based on the group demographics and employee census that we would send you. Carriers will accept eligible employee waivers, and plans are guaranteed issue with no medical questions. We also offer level funded. Now, level funded was around prior to when the marketplace started. With the rising cost of healthcare, level funded plans are becoming more prevalent. You can actually save probably 25, 30, or even 40% through level funded over a major medical health plan. The level funded requires a minimum of 2 employees. Now, this is also based on your state. Some states may require 5, others may require 2 or 3. Rates are based on the group demographics, employee census, and medical history. And again, I want to stress medical history. Groups can be rated or declined by the health carrier. Carriers will not accept eligible employee waivers. However, we've submitted a couple groups over the last couple of weeks, and they will accept eligible employee waivers. Our third option, and by far the most popular, is our low-cost voluntary group medical plans, which function similarly to an association health plan. These plans are a great choice for franchisees focused on cost containment, providing practical, everyday benefits while meeting ACA compliance standards. We offer a range of options. Our WellCare plan covers preventative services only. Our Prime Care plan adds limited primary care visits to the preventative services. Our Elite Care plan, our most popular option, which includes preventative services, primary and specialist care visits, urgent care, lab and x-ray services, and generic prescriptions. Each of these three plans that I've mentioned, Well Care, Prime Care, and Elite Care, requires only one enrolled employee. Again, we only require one employee to enroll for these three plans. For more extensive coverage, our minimum value plans cover inpatient and outpatient hospitalization, emergency room visits, pregnancy care, home health care, chemical dependency treatment, and prescription drugs. These plans require 5 enrolled employees to qualify. And again, we need to have 5 in order to qualify for the more comprehensive type plan. So again, we offer 3 plans. But when it comes to the group, we offer the voluntary well care, prime care, and elite care, which we only require one. We have the comprehensive plan, which we need census, and then we have the premium and the max minimum value plans. Now, the plans that are on the screen, we have rates that we would provide you with the employer guide. Our benefits enrollment platform follows 4 simple steps, guiding you from the initial contact through the employee enrollment process. First, we would identify your objectives. Second, we would review your benefit options. Third, we would provide clear and easy to understand benefits communication. And 4, optimizing the enrollment process through our integrated portal. So from the beginning to the end, we would work with you on setting up the program, getting information from you, providing you with plan options, quotes, rates, provide you with suggestions, including, formulate a benefits plan. Then we would provide you with some type of communication. It could be a simple by fax, or we would provide you with a employee guide, and then we would set up a enrollment portal, which you would have complete access to. The employees then, once we receive contact information of your employees, we would enter the demographic information into the system. Then we would send your employees login information, they complete their profile and go through the enrollment process. You would have access to over 30 types of reports. Coming in 2005, our enrollment portal could be integrated with your payroll system, so it would be a one-step enrollment process for you. Many franchisees ask us to help them build benefits programs to attract and retain employees. We offer a range of popular solutions that can be tailored to your specific needs, whether it's voluntary benefits, employer contributions, or more comprehensive plans. We'd be happy to work with you to find the right fit for your business. Looking ahead to 2025, there's a lesser known ACA requirement for small group health insurance. It mandates an annual 1-month special enrollment period, which is November 15th in a couple days through December 15th, specifically for employers in the small group market who don't meet the usual minimums for employee participation or employer contribution. Typically, health insurance carriers require that at least 50% of eligible employees enroll in coverage. However, during the special enrollment period, only 2 full-time employees need to enroll to qualify. An important ACA clarification. Spouses, which includes, the husband and wife, are considered as one employee under these enrollment rules. Many brokers may not be aware of this option, and insurance carriers often don't promote it as it allows more flexibility for employers who would otherwise face stricter participation requirements. We do find that many franchisees consist of family only. If you, husband and wife, have a dependent child that works with you that's over age 18, you can enroll in the special enrollment for a management only plan. Again, this is probably the busiest time of the year for us. This is when most employers that can't afford to enroll other employees will enroll during this 30 days. And again, it is part of the ACA. You must be enrolled by the 15th. If you don't enroll by the 15th, then you will have to wait for next year. So if you're looking to put in a comprehensive major medical plan, this is the time to do it. You have 30 days from beginning, I think it's Friday, through December 15th. For more information on our Mainline Brands Franchisee Benefits Program, on the screen, you will see Michael Rubenstein, my son, his details. He will be your contact for Mainline Brands moving forward. The QR code's on here, so you can, I'll leave this on for a few seconds here, and you can download his calendar and his information. Now I'm going to open it up for any questions or comments. I know I probably went through this kind of quickly. We are recording this. We will be sending out a recording as well as the employer guide and Michael's contact information, so you can follow up and reach out to him. You'll have the employer guide, and then you could work with him on setting up a program.
Bernard, this is Chris. I know a question I got a lot, sort of after we talked about this at conference, and I think, and I'm glad you're here to bring clarity for us, because benefits can be one of those very, very confusing things for not only just business owners, but just individuals enrolling, right? But the plans that you presented that were voluntary plans, not the sort of main large group benefits and everything, but the voluntary plans that can be offered to all team members. The difference, sorry, in that versus the others is, obviously levels of coverage, but also those are things that the franchisee can choose to contribute to or not contribute to, correct?
Correct. Once you receive the employer guide, you decide how you want to set up the program. If you want to contribute or you don't have to contribute, you decide how you want to set up the program. All the plans that are in the guide, you decide which plans you want to offer. Totally up to each one of you.
Yeah, and I think that was great when we provided, when we presented this, I believe we gave everybody a QR code to have a link. And I see one of the questions that's come in already is sort of wanting to know where they can look at the rates for the offered plans. So for all those voluntary plans, it's part of that benefits guide that we presented at conference, but also I think we'll go out in the follow-up information, and Bernard will be providing it to you all via email as well. As to those voluntary plans are set rates, they for everyone don't change, and they're not based on your group demographic. So those plans already have. And then Bernard, if you can talk about how rates are set for some of the group if you're looking for more of a comprehensive benefits plan.
Yes. So if you're looking for a major medical plan, again, reach out to Michael. He will send you a census form that we will need to be completed, return it, and then he'll be able to provide you with a available plan options as well as rates. The two voluntary plans, the MV plans, along with the MEC plans or the three simple plans. Those plans the options will be in the guide along with rates. So again, we also offer dental, vision, and other voluntary benefits. All those plans and rates will also be in the guide. Again, you set up the program how you want it to be set up. I see we have a question here regarding Canada. Canada is a little different than the US benefits because of their social medicine. They do have their own medical plans. We are working with a brokerage firm in Canada to see if we can put together a program for the Canadian franchisees. We do work with many franchise systems that we're trying to put together a Canadian program. Us being, we're out of Detroit area, so we do have access of working with Canadian brokerage firms. I see we have another question here. Are seasonal employees eligible for these plans? And if so, does coverage continue during the off season? Well, that's really up to you how you want to set up the program. You can set it up for seasonal workers. However, just remember that if employees leave, you are responsible for the monthly premium. When you do terminate an employee, if you paid the premium, you will receive a credit for it, so you don't have to worry about being out on any premiums paid. What companies do you offer plans with the regular group health plans? Our main carrier that we utilize is United Healthcare on a national basis. The reason we do that is most carriers, I'm going to use Blue Cross Blue Shield, is based out of each state. United Healthcare is also based out of each state. We go through corporate United Healthcare because we have our own sales team, our own claims team, our own eligibility team, service team. So we go directly to corporate. Whereas if we had to go through each state, it could be days to get answers back from their representatives. And remember, we're going through open enrollment time, and January 1st, there's a lot of enrollment, so carriers are way behind. So that's why we have our own team, and we're going through a reputable carrier, United Healthcare. Another question, is there an HSA option? Yes. With our major medical comprehensive plan, we do offer HSA. Chris, did you have a comment you want to add to that?
No, I don't think so. I don't think so. I apologize if I hit a button.
Okay.
Yeah.
Another question, we are currently enrolled in a comprehensive benefits plan that re-enrollment begins in February, but would like to look at moving our plan and get a comparison. When would be a good time to start the process? Rates are available for the first quarter of 2025. So yes, you can reach out to us now. Reach out to Michael. And again, I'll put his info in here. You can reach out to him and let him know of your February renewal date and let him know that you'd like to have a census form so he can send it over to you. Let's see.
Yeah, I think one of the first questions is sort of re-enrollment each year. So if they enroll, it sort of comes to the open period each year where they would go through, and depending on the type of plan you choose, but pricing would change on a yearly basis, correct?
Yes, you just brought up another thought too, Chris. When it comes to the major medical plan, that can be set up anytime during the year, and you will have a 12-month rate guarantee. When it comes to the voluntary programs, and that includes the medical plans that I showed on the screen, as well as the dental vision and the other benefits, those plans are a calendar year basis because it is a mainline brands exclusive program. And the way we set up those plans are on a calendar year basis. So if you enroll in February, then you will have a 11-month rate guarantee. Now, some of the plans we offer do have a extended guarantee. I don't remember which plans, but we do have plans that may have a 2, 3, or 5-year rate guarantee. Uh,
And I think it's important, Bernard, is that, as we talked through, knowing how so many of our franchise operations roll and how many employees most people have that, in a lot of cases, there's not a need for a large comprehensive group benefits, right? This is more of where you being able to offer voluntary to, if you have no employees and are looking for one employee, to be able to offer that to that one employee. And if they choose to enroll, then, that you can qualify for the program on these voluntary things. So it helps from a very low cost, way of entry in for the franchisee, but to be able to allow. And I think when I went back and looked at the benefits guide, which I put the link in the chat here, I believe, the plans is low for an individual is like $60 a month for them to choose that themselves. And it helps them get some good coverage in that. So I think one of the questions is how, if I only have two employees, how do I use that? But I think that's something that sometimes it's a little, I heard a lot of feedback at conference. People was like, can this be real? Can I really offer this if I only have one or two employees? We have benefits ourselves as the owners, but we want to be able to offer something. That's where those voluntary plans perfectly fit into that.
Yeah, and to add that, we do have many franchisees that will offer a program to their employees, and let's say they've got 5 or 10 employees, only one employee just wants dental or vision, we'll take that one employee because of our exclusive benefits program for mainline brands. So it does go down to one. Now, just remember, when a comprehensive major medical, let's say through United, they do require two because two is a group, then that's a little different than the voluntary
Yeah.
side of it. Question here is, do you have restrictions on California? No, believe it or not, California is our biggest state that we have groups in. We started many years ago with Grocery Outlet, which is big in California, and since then we've moved in more into the franchise world. So California is by far our biggest state, so we don't have any restrictions. Let's see here. If we provide the option of a health plan to an employee, does it impact their ability or pricing they could get from the exchange? Totally different than the exchange. If an employee is receiving uh, subsidy from the marketplace, chances are their premium may be lower because they are receiving a subsidy. However, most of them, if it's going to be a lower premium, they're probably going to have a high deductible. And again, if you've got 3 or 4 employees and let's say two of them are on the marketplace, then we can waive those 2 employees if you're trying to insure the other 2 or 3 employees. So again, there's ways of getting around the eligibility. It's probably best to reach out to us because every group's going to have a different need. Uh, Another question, can we enroll employees at any time during the year? Yes, you can. You will have access, like I mentioned, the enrollment portal. You, whoever your administrator is, if it's you or another employee, that employee can add the employee. We'll show you how to add the employee, and at the time that you terminate employee, we'll show you how to terminate the employee. Our plans are integrated with the carriers. So if you enroll an employee, they go through the process, enroll, then they will be integrated with whatever carrier they select. And at the time for termination, it would be the same. Let's see, do we have any other questions
Yes,
here?
I think one question, I know you say that United Healthcare is sort of the main thing, but is Blue Cross Blue Shield an option in some states, or can you help craft a program to a different provider for specific states?
We do work with Blue Cross in some states. Again, just to let you know, we are at the open enrollment time. For us to receive proposals or to the service that we may receive um, may be delayed. are working with United Healthcare. If you decide to go with United, then we have access to enrollment within hours. So we can get you enrolled and have a policy number for you, if not the same day, the next day. So that's how quickly we can have get things done with you through United and our workings with their teams out of corporate.
Sure. And I was putting things in the chat, links to the things. So I just wanted to make sure. So did you answer the question about enrolling employees anytime during the year? I think you did. I just want to make sure before I mark it as
Yes, I did
answered.
answer.
Okay,
They can enroll an employee anytime and we can help them make sure they know how to enroll.
great. And then JJ and Lisa, I believe we answered your question just sort of about you can use this as a recruiting tool to be able to offer benefits, even if you don't currently have, yeah, being employees, as long as, someone's going with this volunteering and you're not looking for a more comprehensive overall group plan. So,
Correct. A couple of things I want to mention here also. Chris, you mentioned about the guide and the chat. I think the guide that you might have might be a 2024.
yeah, it's the one that we had right before conference, correct?
Yes. So what I'm going to be sending out will be the 2025 guide. And we do have new plans. I think the medical rates may have changed a bit, but most of the plans that we offer, the rates will remain the same as 2024.
Awesome. Yeah, and you all have been receiving for probably right on about 2 weeks now, emails directly from Bernard and his team at Franchise Benefit Solutions. So we wanted to make sure that you had a direct line to work with them as well and weren't waiting on sort of communications and all going back and forth through us. So we made sure. So you'll be getting all this information from directly from the Franchise Benefits Solutions team as well.
Exactly. So, can monies be directed? Sorry, another question just popped up here. Can monies be deleted, or I'm sorry, deducted pre-tax? Yes. Our programs are set up, so they are set up for pre-tax and also for COBRA. So if an employee leaves, on the voluntary medical side, they will automatically receive COBRA documents because of the way our program is set up. When it comes to the comprehensive major medical, if you have under 20 employees, COBRA is not involved on a federal basis. But our program, because we have, it is our program that we set up for you. It is COBRA administered, so they will receive COBRA documents for the medical.
And I've got to say, this is one reason I'm so excited to sort of work with Bernard here, because all this obviously can get so complicated, and as all of you as small business owners, this is the last thing sometimes some of you might take interest in working through insurance plans. But the beauty of partnering with Bernard and his team here is that they are true partners. All the enrollment, everything, any questions with employees and everything, you don't have to be an expert in that. Their team completely helps guide this and make sure that the administration of everything needs to happen happens on the backside. So really a true partner, not just a program for you to go try to figure out how to get rolled out, but really someone who is there to help all along the whole way and take that completely off your plate and just let it be a benefit that you're truly offering to your teams.
Okay, so if we don't have any other questions, I want to thank you all for joining today. We appreciate your commitment to your business and your employees, and we look forward to working with you. Please reach out if you have any questions. Chris, thank you for helping me present this program to your franchisees. I appreciate your rescheduling the webinar from last week to this week. Uh, Everyone else that's on the webinar here, thanks again and have a great rest of your day.
All right. Thank you, Bernard.